And welcome to another show. Dr. Katherine Tomasino, PhD, and co-director of the Behavioral Medicine for Digestive Health Program at Northwestern Memorial Hospital in Chicago. She's my special guest, and I'm fortunate to have her on my show. Welcome, Doctor.
Thank you so much for having me.
Well, Doctor, the holidays can be a very stressful time for us all. Adults usually have more, on their lists, to-do lists. And while holiday parties and gatherings can bring a lot of fun, extra time with family and friends, and gift-giving obligations, they can also cause a lot of stress. And for some people, apparently, the season can bring up grief about loved ones or past relationships. What say you?
Absolutely. The holidays can certainly be a time of increased stress, of memories, and of loss, in addition to the joy that they can bring.
Yeah, research seems to show that there is a strong two-way connection between the gut and the brain. And psychological factors can affect a person's gut health big time, and a person's gut symptoms or condition could also affect their psychological health and well-being. I guess it can spell a lot of trouble during the holidays because, sugary treats like fatty dishes and excessive alcohol, they're in abundance, and they can cause digestive trouble, making a person miserable instead of all joyful.
Absolutely. Yeah, so the brain and the gut, and when I say the gut, I mean really the whole digestive tract, are connected through this bidirectional communication pathway that we call the brain-gut axis. And this pathway can become dysfunctional or dysregulated at times, in particular during times of high stress, like around the holidays. And when that happens, normal digestive processes can become disrupted. Our brain might not do its job tuning out signals from the gut, so those digestive processes can be experienced as much more uncomfortable or intense or painful. And then at the same time, the brain might be sending signals down to the gut that causes changes in our gut functioning, leading to changes in how quickly or slowly things are moving through the gut. So we can have more bloating, reflux, constipation, or diarrhea, and also impacting what we're feeling in our gut.
So let me ask you this then. Are these psychological causes?
That's a great question, because I think a lot of people feel like when they hear psychological causes that these symptoms are all in their head, or that someone is telling them that. And I like to clarify, we call them psychological because we put stress under the umbrella of psychology, but they're absolutely real physiological changes in the gut. Just because your brain is involved does not mean that these things are all in your head. So these are behavioral, they're psychological, they're emotional, they're cognitive things happening in the brain that are impacting our gut functioning, but our gut functioning is absolutely impacted. When you feel butterflies in your stomach, that's not just in your head, there are actual gut changes happening because of the emotions that you're feeling.
So is it easy to remedy? What steps need to be taken to help people?
That's a great question. I think, one of the things when we think about during the holidays is you can't actually just get rid of a lot of this stress, right? So a big part of my job at Northwestern Medicine and my colleagues' jobs is to help people learn different strategies for managing stress and the stress response in the body that is impacting digestion. But that doesn't necessarily mean all of a sudden you just stop doing the things that are on your to-do list. What we're really talking about is how can we optimize our body's response to stress and how that then will impact our gut functioning. So some things that you can do if you don't have access to a treatment provider like a GI psychologist, like what I do, are try to do things that will calm down the nervous system and the stress response that are impacting things. So diaphragmatic breathing is a relaxation strategy that has been shown to help improve nervous system functioning and calm down that stress response, improve digestion. Making sure that you're practicing sticking to your routines, eating at regular times throughout the day instead of going long periods of time without eating and then binging at a holiday party, limiting alcohol and trying to pay attention to your diet, and making sure you're getting enough sleep, which is hard to do when you've got so much on your list. So all of those things can impact how an average person might want to improve their symptoms without any actual treatment from a professional.
I'm speaking with Dr. Katherine Tomasino, PhD, and if anybody's going to know, you'd know, but are there any new treatment options on the horizon?
Absolutely. So, when you say new, I would say that relatively new. We've got a lot of science-backed, evidence-based strategies for how to improve gut functioning using these brain-gut behavioral therapies or psychological treatments. And those include cognitive behavioral therapy as well as medical hypnosis. And some of these treatments have been actually translated into mobile apps and web-based treatments. So they're new in the sense that the evidence has been growing for them for a couple of decades, so still relatively newer. And the other part that's new is that they've been translated into these treatments that are more accessible now online.
Well, folks, I don't know if you know this, but there's a specialized team of psychologists at Northwestern Medicine, and they help patients learn to cope with their physical digestive systems and manage their psychological stresses so that they can get more out of life. It improves both our digestive health and overall functioning. Pretty big responsibility team. Tell us about Northwestern Memorial Hospital, a bit more about the Digestive Health Program, if you would, Doc.
I'd love to. So we're really proud of our program, and we're integrated right within the gastroenterology and hepatology clinic at Northwestern Memorial. So we work alongside the physicians and the APPs and the dietitians who are also treating patients with gastrointestinal conditions. And we actually have the largest team in the country. So we have 5 clinical psychologists who are specializing in GI, so GI psychologists, and then an additional GI psychologist who focuses on researching these conditions and developing novel treatments to improve digestive health.
Well, when you mentioned before, it did surprise me, to be honest, when you're talking about cognitive behavioral therapy. You touched on treatments like medical hypnosis, and cognitive behavioral therapy for stress management. It corrects the communication, this is interesting, between the gut and the brain. So they begin to feel better, and then they respond better, apparently, to medications and even surgical interventions as well. That's pretty cool, isn't it?
It is really cool. I think that my job is very cool because of the significant impact that these treatments can have on digestive functioning and improving brain-gut health. It's really remarkable, and to watch patients get better through these treatments is very rewarding.
Yeah, you've got a lot of special training, haven't you, in gastrointestinal psychology to help patients with all of this. Chronic digestive problems are not fun. Lots of pain, difficulties related to their weight, and so on and so on. What are some other factors that stand out?
I think that one of the things that a lot of our patients have to manage is people just not really believing what is going on is real. If we talk about the way that stress can impact medical conditions and impact our body's functioning, often people start to discount that. And so there's a lot of stigma around it. There's also some level of embarrassment. People don't feel very comfortable talking with others about things like belching, reflux, diarrhea, abdominal pain.
Yeah, not very sexy.
So it's certainly not. And all of that can just really increase anxiety for patients who have to manage these conditions. And it can lead to really limiting people's quality of life. They might not feel comfortable going to gatherings, which can really increase stress. So people with digestive health conditions around the holidays have extra stress because now they're worried about going to these functions, what kind of food will be served. Many people have dietary restrictions that some people might not take very seriously. So all of those things can add to stress for patients during this time.
Yeah. No, you're absolutely right. And unfortunately, it stops a lot of people from doing things that maybe they'd like to enjoy. Folks, you've got to read more about this, and it's simple to do. It's a wonderful site. Just go to this domain address. You can read all you want with a cup of joe or herbal tea, whatever turns you on, and visit www.nm.org/radio. All right. Hang on, Mark. Let me write it down. All right. Okay. Here we go. One more time. www.nm for Northwestern Memorial, nm.org, not com.org/radio. Always wonderful speaking with you, Doctor. You always enlighten my knowledge. It's wonderful. Thank you.
Thank you so much for having me today.
Dr. Katherine Tomasino, PhD, co-director of the Behavioral Medicine for Digestive Health Program at Northwestern Memorial Hospital in Chicago. My special guest on this Mark Bishop episode.